Nancholi Youth Organisation, NAYO in short, is one such non-governmental organization that was established in 2004 to help deal with various issues affecting the youth and adults alike in the suburban area of Nancholi in Blantyre, Malawi. It is working hand in hand with the government of Malawi and many other stakeholders, including foreign volunteers. NAYO is unique. As an organization that focuses much on the plight of the youth, it has chosen to establish its offices right in the heart of its catchment area, Nancholi Township. The area is visibly poor. The advent of HIV/AIDS pandemic has attracted much attention the world over. This has made people think that malaria is no longer the #1 killer disease the world over. But the situation is different at NAYO. Malaria is given the attention it deserves, and several interventions have been put in place.
I think when last year, after the project finished and NAYO began sending us proposals, I think it became obvious very quickly that the main issue that we should focus on should be malaria. It is such a devastating disease that has such an impact on individuals and on families and on communities and just on the development of the country as a whole. And I think what really makes it worse is the fact that it is such a preventable and treatable disease given the right resources and the right knowledge. And I think it became obvious very quickly that it was something that we should be looking to address in the project this year.
According to the World Health Organization report, Malawi continues to lose its productive citizens and children alike to malaria. Malaria prevalence rate in Nancholi stands at 85%, while in Malawi it is 110 per 1,005 children dying every year, and the figure is more alarming in people aged between 15 and 60, as over 496 per 1,000 die every year. 90% of deaths from malaria occur in sub-Saharan Africa. Half the world's population is affected by malaria. Yes, malaria is a global challenge. Spraying homes with pesticides is one method used in malaria prevention. Craig Riley is from Scotland and is a working volunteer for Students Volunteer Abroad, SVA. Today, Craig is participating in the campaign to deal with mosquitoes that transmit malaria. He is doing this for the first time. He says he wanted to have hands-on experience in combating malaria, noting that it is rated the major killer.
It's good to be doing something hands-on and getting work with the sprayer in the people's houses after having run the awareness campaigns and done so much research around the community into malaria and the perceptions about malaria in the community. So it's good to get some hands-on involvement as well, rather than just organising things.
NAYO has been hosting foreign volunteers since 2011. They have come from Scotland, Canada and elsewhere. These volunteers have engaged the community in different fields. whose house was sprayed is HIV positive and is all smiles for the exercise conducted by Craig and friends, and also the clinic which has been constructed close by.
Kuchambiri mangogeza ti mwina malungo basama ngobwera chabe silimazindika kuti amayamba ndi kumbali ya udzudzu kapena kusasamala kwa pakhomo kapena kusasamala kwa nyumba. Nkumete maganiza kuti mwina poya pachiyambipo zimene zozo zinalibe ntchito koma panopo tikuona kuti kusamala kumene kokotatu usamale ndi kuti malungo achepa. Fera nyadira kwambiri poti mangira chipatala ifeti apa pali chipatala ndiye iye atizithamangira mufupi oti munthu akamuyamba malungo tiziona kuti mwina kodi munthu mpumulo akapumula bwanji.
Mosquitoes breed easily in stagnant waters, long grass and unhygienic homes and surroundings, a scenario which is very common in developing countries. The emphasis was on malaria prevention. The volunteers did demonstrate how to fix the mosquito net. HIV, AIDS and malaria challenges can best be combated through simple approaches.
I think since being here, there's certainly been a lot advertising and things addressed towards HIV and AIDS. Well, I think what really strikes us with HIV and malaria being so similar is the prevention, because both can be so easily prevented given the right knowledge. So both should be, we feel, addressed at the same level and at the same importance. Both are devastating yet preventable.
No wonder all stakeholders, including traditional leaders, are championing the fight against malaria. The construction of a clinic in Nancholi is a blessing as it will help in the fight against malaria.
Kweni ndingalini kuti makamaka matenda amalungu ndamene amafika pafupi. Kusina ndi matenda ena osiyana amene amachitika. Kwa matenda amene akuti amafika pafupi ndi matenda amene timavutika nawo kwambiri akulu ngakhalenso wana. Chifukwa chache ife lero tilonyadira kwambiri ife chipatala kuti chafika pafupi kuti matenda ena osali onse titithandizika pafupi malo ano.
Ifeyo tilokondwa kwambiri tikuchiona kuti nchabwino kubwera kwa chipatala ichichi chifukwa amayi ndithu akuzipereka kuti apapa kliniki ili pafupi akutha kutenga ana ena oyenda okha amene sanakwanisa zaka 5 akumafika kwina kumbuyo akumatha kuona mpata oyenda kuzafika pati pa chipatala pano ndikukweza ana skelo ndikulandira zonse zoyenerera zofunikira.
Malaria is indeed a dangerous disease, but through the sensitization campaigns conducted by NAYO, many a mother are now aware of the ways needed in the prevention of malaria and the impact it has registered already.
Malungo kuti tapewe timatha kupita kuchipatala kukala ndi achitetezo neti amatipatsa simankhwala la timamwa.
The success of Nancholi Youth Organization is dependent on good working relationship with traditional leaders. Over the years, Group Village Head Chimile has seen Nancholi Youth Organization grow from strength to strength. She ably articulates some of the activities and developments that have taken shape in the area so far.
Anayamba ndizo tankasonkerana ndalama zawo mtumba ndikumapita kwa nkhalamba kapena anthu odwala kumagulira zinthu zawo kumakapatsa ndi ndalama zawo za mtumba. Koma atayesetsa kumapempha mabungwe ena ndi ena amapatsa zinthu zoti adzikagulira sopo kapena zakudya amayesetsa mmene analonjezamo kunkapereka pena paliponse. Komanso ena anapereka nkhumba zimene analonjeza kuti nkhumbazo akaziweta wina aliyense ovutika adzampatsa khola lake kuti zidzamuthandize. Kwa mpagaja anapanganso ofani imene yamayang'anira iwo. China chilichonse chimene chimasowa pamenepo amayesetsa kumapempha mabungwe omundu umu ndi kumapita kukapereka. Komanso kunchokera anapanganso kliniki imene amalandira anthu mankhwala pakali pano. Chifukwa kumene koko anatalikana kwambiri ndi chipatala.
While there is a lot to be done in the area, Nancholi Youth Organization NAYO says they will ever be appreciative to the role volunteers play in the fight against malaria and other challenges people of Nancholi face.
Yes, there is a lot, but you know, the resources always are not enough. But what we need is more support. It might be financially or technical support. Materially, we need all those kind of support so that people can be saved.
Meanwhile, there is need for donor agencies and partners to join hands and provide the much-needed support to the people of Nancholi. Lives are improving and more could be achieved.
Our malaria campaign with NAYO has been a great success. From the well-attended awareness campaigns to the great responses in the questionnaires, right up to the joy in the people's faces when we distributed the mosquito nets and sprayed the pesticides, we have had a wonderfully successful campaign. However, we realise that this fight against malaria is far from over. Even here in Nancholi, we have only reached out to 5 of the 16 villages. It is for this reason that, first of all, we would suggest that working with NAYO is a great way forward, a great opportunity to work with a wonderful NGO who are very forward, very one-on-one and very open in their communications. Also for this reason, we would suggest that any organisations wishing to help out in the fight against malaria should become involved in Nancholi. We need more help there. Just to summarise, the fight against malaria must continue. It is a preventable disease. The correct resources and the correct knowledge is all that is needed. Thank you very much.
It is true that more could be done only if you too could reach out and touch someone in Malawi in dealing with malaria and other problematic issues facing the youths and other vulnerable groups.